Oh, you know, I say the same thing. My dog's actually the CEO of my clinic.
Yeah. What kind of dog?
Cavapoo.
What's that?
Oh,
Cavapoo?
it looks kind of like Buddy.
Yeah,
a little bit like Buddy, but
What's a Cavapoo? Exactly?
Cavalier and a poodle.
Because he's half poodle.
He's half poodle. What's
Bernese?
Bernese?
Yeah.
He probably smells my dog.
So, and then I got a couple of German Shepherds running around outside.
you do?
Yeah, they're awesome.
Oh, you're a dog
I can
lover.
show you them. Oh, yeah, he's got some Buddy in him.
yeah.
That's awesome. Yeah, he's the best.
Oh,
Yeah.
okay. You're chilling with me today.
My wife is very anti-dog. And so, she's cold-hearted. No, she's just anti-dog and anti-husband. But it had to be this kind of dog to break the seal. So COVID, like the beginning of COVID, whatever, convinced her to get this one. And once that happened, then took advantage.
Sure.
Like,
and that's when you got together.
Yeah, totally.
But it was cut with the puppies.
Yeah.
Your luck was cut with the
Yeah,
puppies.
then my German Shepherds had puppies. And there was a couple of 3 months where we had like 9 dogs.
Yeah.
8 dogs.
Yeah.
And then to be honest with you, I was like, this is too much. Because puppies take a lot of work.
That's a lot.
They had to be inside. They were pooping. We'd clean the basement every day, like 3 times. It was a mess, but I love them. So now we gave them some people and they sent us pictures and they're like bigger than Kobe and Sky, bigger than their parents. So, but I mean,
How big was the litter?
there was
4, 5,
5,
and
one died.
One died.
Because we didn't know they were like even. So, but they're great. But yeah, I'll show you the German Shepherds. They're awesome.
For sure.
So thanks for doing this.
No, of course.
I really appreciate it.
Thank you.
We were just meeting, but the team was updating me on your background, and I think it's super unique. I don't want to tell your story for you. I'd rather you did that, but I think the viewers and listeners are in for a real treat because physical therapy itself is, I think, a part of healthcare that's less understood than let's say, pediatrics. Like you go to the average person, you're like, what is it? By the way, the average person and the average doctor. You go, hey, pediatrician, they're like, yeah, give vaccines. If a kid's sick, go there. Most people don't get that wrong. Physical therapy is one of those where I think as time has progressed, we've understood that non-aggressive medical intervention is extremely effective with low side effects. And so physical therapy through my 15-year career has really found its way into the center of things that used to be medicine and cutting you open. And so, and then your take on it is even more unique. And so I don't want to steal your thunder. Usually what we do is we ask our guests to talk about their personal journey. So, we want to hear all about like your practice and what you do and how you do it differently, because I think that's really cool. But if you don't mind, just take us through like your journey and your personal story and how you got to where you are.
No, for sure. Well, first of all, thank you so much for having me. My personal journey, wow, where do I start? To sum it up, I'd probably categorize into like God, Google, and my current wife. That's probably gonna
That's
summarize
cool. I'm
everything,
intrigued.
right? So I'll start with, I graduated in 2006, and I majored in psychology with a concentration in finance and business administration. Got a job. It was right around the mortgage the subprime crisis, and I was actually in mortgage banking.
Oh, wow.
Yeah, I was in it.
That's interesting.
And I was doing that for a few years, working a lot.
Okay.
The money was good.
Yeah.
Bought a house and everything, but circa 2008, I actually got pretty sick. I had too much fun, a lot of extracurricular activities, and really physically, emotionally, just really got into a really dark place.
Okay.
And I really had to leave Chicago to come back home to New Jersey to take a little bit of leave of absence, right? Okay. And it was kind of like this, it was the first time in my life where like you're in this dark place, right? And you're just like, wow, I'm actually debilitated. I had to take a leave of absence. I lost a lot of weight. I probably lost about 40 pounds.
Wow.
In about 6 weeks. Right.
Was this physical ailment, mental ailment,
both,
combo?
Probably a little bit of both, right? And I never experienced this. This was all new territory for me, right? So I was like, wow, this is where I'm having this like meet Jesus moment. What am I doing? You know what I mean? And so during that time, I was just like, all right, reflecting, is this kind of the career trajectory that I want to do, right? Is this something I really like? And And that's when I really started looking around to be like, hey, is this what I want to really pursue? Is mortgages and corporate financial services something that I really want to pursue for the rest of my life? I still had to make a living, so I was still working in the industry. And so I went on Google, literally, and was like, all right, top 10 most attractive professions.
Yeah.
And physical therapy was actually one of them at the time. I don't know if it's still there at the moment, but it was,
Interesting.
right? And I was like, all right, I had no experience with physical therapy. I grew up doing martial arts. I was pretty competitive in it. I got injured a bunch of times. And believe it or not, I had exposure to a little bit of acupuncture and just rest. Let the pain, the pain will resolve and you'll get back at it, right? That was my form of therapy. And, I was like, all right, let's look up how I have to get in PT school. It's a grad program. I took no science courses in undergrad. I was like, all right, I need a bio and a couple courses. So I started taking some courses in the evening while working, right? And taking some observation. All the grad programs needed some observation hours, right? So I was placed at Lenox Hill. I had the opportunity to work in some outpatient settings. And I was like, all right, this sounds cool. And more importantly, a lot of the PTs seemed very happy. They really enjoyed what they were doing, which was very different from the industry I was in, especially during that time, if you remember, that subprime era, right? And so I was like, wait, I like this. Like, I think my one of the people I was observing, like, he would ride his bike, right? I think he lived in upstate. He would ride all the way to Manhattan, right? Shower, do his shift, and then ride back. And I was like, wow, that's cool. He's in by 7, out by 3.
Yeah.
I dig that. You know what I mean?
Yeah,
and so,
sure.
all right, I'll try applying to physical therapy. I was living in Manhattan at the time.
Okay.
And I was like, I'll apply to a few schools, looking at tuition rates, Hunter being, I was applying to Hunter. I was like, Hunter's going to be my top choice. It was economically the most sound probably choice if I can get in. NY and LAU. Those are my 3 options. And I was like, all right, I'll try to get into these schools. I want to stay in New York, be close to family, still, overcoming my own, issues, like my health issues all the while. Applied to Hunter. That was the first interview that I actually got, right? And so a month after I get the interview, I get the acceptance letter. I haven't even heard back from NYU or anywhere else yet. So I was like, all right, once again, I was like, I guess I'm going to Hunter, right? And this was around 2011. I get this decision. Hunter's program starts in 2012, that summer. Get in, loved it. It was nice to be a student again. I'm like, you know what? I just made a big choice. I'm gonna move towards serving people, helping people. I love this, right? After my first year, all the physical therapy programs, you do your affiliations or rotations in your second year.
Okay.
Right. You do your first.
How many years total?
3 years.
Okay.
3 years. And I did my first rotation in an acute care setting. And so the physical therapists who are working in an acute care setting, they're really working with a lot of medically unstable patients. And our job in that framework, just to generalize it, is to make sure, is the patient stable enough to be discharged into either a subacute or a neuro inpatient rehab or to go home. And one of the criteria is to see if they can walk, right? With some level of assistance or independently, right? That's my role as a student there. And in the first few weeks, my first time, walking with a patient and stuff like that, he has a bowel movement, right? And just, does his business on me. And I was like, wow, clearly never had this experience. And quite honestly, I was like, what did I sign up for?
Yeah.
Right? Like, I was like, wow, like me Jesus moment out the window. I'm like, wow, what did I do? And, I come home and I'm talking to my girlfriend, my wife now, and I was like, I don't know if I'm cut out for this. You know what I mean? I don't know if I'm cut out to do this, right? And so she was smart. She was like, Dave, you started this, right? Like, you got to see it through. Mm-hmm. You know what I mean? You have to see it through, right? You're only halfway through. Mm-hmm. You only have halfway more to go, right? Just in the grand scheme of things, you have another year and a half left. Who cares, right? And what's crazy is a few weeks after that, I take this course that was offered by the program, the Hunters program, and it was an extracurricular kind of continuing education course. That was one of the requirements to graduate the program. And that was the first time I took a continuing education course through the Institute of Physical Art.
Okay.
And that's actually where I'm kind of affiliated with. That's where I did most of my training.
Is that separate from Hunter or within Hunter? Or?
No, it's a separate continuing education philosophy. It's a paradigm. It's a school of thought.
On its own?
On its own.
Okay.
Right? And Hunter hosts a lot of these courses, whether it's through the
I never
Institute.
heard of it. Okay.
Yeah. And so when I went to that course, very intrigued. I was like, this is what I want to do. Like something just clicked, right? I was like, I feel like I have a calling to do something like this.
What were the main features of that?
Manual therapy.
Okay.
Specifically functional manual therapy.
Okay.
Right? And just the way of approaching, human function, movement, the evaluation process, even the interventions that they were doing, it was very, very different from what I was exposed to.
Okay.
Right? In my observation hours and some of the working environments that I've been exposed to, right? This was just brand new.
Okay.
Right? So in my third affiliation, I spoke to my professor. I was like, look, I want to be placed with someone who does this. Right? And I was placed there. I spent about 9 weeks there, graduated. And, after you graduated as an entry-level PT, the options for you, a lot of times your options are pretty limited.
Employment options.
Employment options.
Like now you're graduated.
Yeah, you graduated, right? Employment options are pretty limited. And so I took a job in Jersey, and it was a great first experience, a little more high volume, right? But then my mentor, who I met during my last rotation, the one that I really fell in love with, he gives me a call and he's like, you want to come work for me? You want to really learn this craft.
In New York?
Yeah, in New York, right? And so I was like, yeah, let's go, right? And so I was there from 2016 to 2020.
Wow.
Right? So that's kind of like, my journey in a nutshell. And all this time, like I had a private practice because I graduated in 2015, working full-time in this entry-level position, but I knew that I was like, look, I want to, learn more and really kind of understand this new paradigm. So I rented a room, saw a patient, one patient at a time, 1 hour, really trying to understand like an evaluation process, really kind of hone my skills. And when I went over to New York, I was working there 3 days a week, full days, and then Tuesdays and Thursdays, I was in the Fort Lee practice. And that's what I was developing.
That was your own practice?
Yeah. And in 2020, when COVID hit, I was like, I need to save my practice.
Right.
You know what I mean? That's when I came full time for the first time.
Okay.
Right. So that's how it evolved.
And tell me, that's awesome. That's really, I'm going to get to the clinical stuff because I'm very curious. But, and Mo can tell you, like, when we first started doing this thing, whatever we call it, like a podcast or IG Live or whatever it's called, when we first started doing it, one, it was just me and Mo. And then probably I don't know, a year or less ago, we started getting guests on. And then after we got a bunch of guests, you'd get like a cardiologist and he'd talk about cholesterol. And that's great. And we need to know that. And that's cool. But then where it's evolved is I find that the journey, the personal kind of story, whatever you want to call it, of the folks, it's funny how you learn as you talk to people. But now I find that the background of the individuals is so interesting and important to understand because we're looking to get the stories out of the people who have a unique perspective on healthcare and that are at the avant-garde or cutting edge of healthcare because we know most of healthcare is screwed up. The type of people that are doing unique and effective things, counter traditional healthcare, are themselves unique. Mm-hmm. Right? The guys and gals who had their head down and went from A to B to C and are doing D that everybody else is doing are part of the problem almost. Not because they're bad people, but it's the people who took a sharp left turn and they're kind of counterculture or have a rebellious outlook, which takes courage. Like your story is full of courage. Like, dude, to be in finance, in a big city, living it up and stuff like that, that's everybody's dream. Most, I know a lot of guys in healthcare who, they would love to do that. I don't know many of the guys that look at what we're doing. We're I want to be of service and so on. And so I think that's really interesting.
It's interesting you bring that up, right? And looking back, reflecting on this, all throughout even undergrad, right? I had my finance internships, right? That's what you did in the summer, right? You work for a bank or whatever, right? But what was interesting during the school year, I was part of a juvenile restorative justice program. I was working with like juvenile detention centers and like kind of looking at what's wrong with our current system right now.
Okay.
Right. And just kind of, that's where I spent my time. That's where I actually felt a lot of passion.
That's criminal system.
Criminal
Yeah,
system.
yeah.
Right. I was working with high school, like, you know, the underrepresented youth that were in like very, you know, tough situations, like in their families and whatnot. Right. And, you know, that was always there. Right. Like growing up, like volunteering at soup kitchens or whatever. So, you know, to take a big circle back, I feel like that was an element that was really missing in my life in kind of the corporate setting. Not to say the industry I was in is not a service industry, right? But I felt like I really wanted something a little more tangible, right? And I felt like healthcare does that. It's purely at its core a service industry, right? And so we're serving our patients, we're serving our peers to the best of our ability.
Yeah.
Right, to hopefully find some relief and give them a solution to achieve some of their, in my case, functional goals, right? So now I feel like, I think I'm kind of living out my purpose, right? And it's fascinating that you bring that up because my wife actually says that all the time. She's like, I think you are meant to kind of go through all that, and that's going to kind of determine how you practice, and it is, and she sees it, right, from like the third eye in.
Yeah.
So.
Yeah, I think like the more of these conversations are happening, because, you know, our goal is to kind of educate viewers and listeners on things that they're not getting about healthcare and wellness and hearing from the smartest, most innovative people. Because there might be 1,000 people who hear this who have screwed up back pain that went to an orthopedic or a different type of physical therapy operation, and they're not getting the right service. And so that's the point of it. But I find increasingly that there's got to be a correlation, because I'm seeing that folks who had a unique path to where they got generally have the biggest impact on patients. And maybe because the amount of courage and commitment it takes to do something like you did, rather than a linear path, is the fundamentals of excessive passion, right? Like to have climbed the mountain, you know, twice, for lack of a better term, professionally, you got to want it more. And so now that you're here, you're really in it, right?
Yeah, no,
so
for sure.
Versus like a guy who like, I always wanted to do this, and when I was 23, I started doing it, you know? So I think that comes through in kind of your journey. And so can you say a little bit about your practice? I know you said you started it, you know, and then you back and forth between New York, but about what it is you do in your practice and what's unique about your practice versus other similar shops.
Right. So the institute that I really fell in love with when I was exposed to the course back when I was at Hunter is the Institute of Physical Art. And it was developed by my mentors, Greg and Vicki Johnson. They're based out of Colorado in the 70s. And they developed this philosophy called functional manual therapy, right? And it's pretty much a paradigm that appreciates that every tissue in the body is interconnected, right? Every tissue. And the paradigm really looks at 3 pillars, which determines efficient movement, right? The first pillar being mechanical capacity, right? Mechanical capacity is, you know, are your joints actually efficient in every 3-dimensional movement, right? A lot of times we're looking at basic range of motion of the elbow, the neck, or whatnot, right? But they take it a step further and be like, 3-dimensionally, can this joint, can this tissue, can this ligament, can this visceral structure, like the organ systems, can they all move 3-dimensionally? Because in the efficient state, you're a pediatrician, you palpate a baby, their skin, their joints, their bones, their ligaments have a very nice, unique, springy end feel. Granted, they haven't been exposed to gravity for as long, but in the efficient state, you should have that nice, springy end feel, which is what we call it. And that's what we're looking at with mechanical capacity. The second pillar would be, is neuromuscular function. Does the muscle or the tissue have the ability to initiate a contraction? Can I initiate that connection, recruit the right motor units? Does it have the strength, right? And does it have the endurance to sustain that strength? And also importantly, does it have the ability to relax, right? And so we're kind of looking at that through observation, palpation, and the unique evaluation processes that they've developed. And we tie that into the third pillar, which is called motor control, which is are they able to utilize that mechanical capacity, all that range of motion they have, with the appropriate strength, with the right synergistic timing and movement of it to throw that baseball in a coordinated fashion, right? So a lot of times when you go to physical therapy, they'll be like, oh, your quads are weak, right? Or, oh, your glutes are a little too weak, right? But that doesn't really give you too much information, right? Because as you know, like function isn't like, oh, nothing works in singular fashion, right? You need a nice synergy, and it's a very complex system.
Sure.
And so in order for you to actually throw a baseball or swing a bat, you name it, there's so many different things that have to be coordinated and moving. And that's what we call as motor control, right? And so it's a constant evolving and evaluation process in every session. That's why the sessions it's really hard to do in about 10 minutes, right? And unfortunately, some of the practices, right, with insurance restrictions and stuff like that, we can only resort to like, hey, Dave, in order for me to afford to pay all my team members and stuff, I have to see more patients, right? But we're seeing everyone, 1 hour at a time, utilizing those principles. So all the physical therapists are functional manual therapists. That's kind of the fundamental framework that we operate on, and any additional paradigms and philosophies that we resonate with is a great integration with that.
And that's really unique. That's interesting. It's very practical. It's very real. Like, what are the top 2 or 3 client types that you see? Like, is it chronic back pain? Is it post or pre joint surgery? Can you talk about
That's a good question. Quite honestly, like, unfortunately, we don't take insurance. I really wish we can, but I'm a single practice. I have 3 practitioners. The reimbursement rate is just not there to deliver this kind of practice. So we don't have too many post-operative cases because you want that frequency. You want a higher dosage for patients to come in. So 2 or 3 diagnoses types that I see, I would actually break it down into about, let's say, 3 different categories. Like 20-30% would probably be what we call acute pain, acute injuries, where someone had a meniscal injury. They just got side tackled or anything, and they had an acute flare up, an ankle sprain. There's now like a ligamentous damage to the tissues, and they're coming in swollen, right? And we're managing that. Second, probably like 50 to 60% of my patients are those that have, let's say, chronic pain. And, we define chronic pain as like anything beyond 6 months, right?
Right.
One of my mentors and another instructor for the institute, her name is Dr. Cheryl Wardlaw. She coined this phrase, sustained acute. And these are the patients, probably most of our patients fit this category. And what she means by that is a patient may have had this pain for 6 months or 6 years or 15 years. And in this framework, we can reproduce their symptoms, right? There's a clear patterning to it, but maybe we just haven't discovered the hidden driver of why this pain is still recurring, right? But there is an element of chronicity to it too, because they've been dealing with for so many years that there is a psychosomatic component, right? So most of my patients fit that category.
So give me like a real, like, was it a car accident? Like,
my patient comes in and be like, Dave, I've been having low back pain for X number of years.
Right.
I get it every time I run.
Right.
At mile number 2.
Yeah.
That's when my back pain starts creeping in, blah, 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 blah. And I just can't shake this off. It's on my right side every single time. Right?
Yeah.
I've been to physical therapy, I've done acupuncture, I've done dry needling, I've done chiro, everything, right? I've heard, you do something a little different, you know what I mean?
Yeah.
Like, what do you do? How are you treating me? I'm coming here like, I don't know if this is even going to work.
Right.
My next option is surgery.
Right.
Or I've done the injections, you name it.
Right.
I clearly have a disc or whatever. A lot of times I'll be like, all right, that initial evaluation would be like, we got to rip into your history. My entire fellowship training in Manhattan, I want to say like more than 50% of it was getting the right history from a patient. Right. The emphasis on how did that low back pain begin? right? And a lot of patients will come in and be like, Dave, here's my MRI reports, here's the X-rays,
Yeah.
very valuable data, for sure, right? Dave, I have a disc at L5S1, L4-5, but quite honestly, the MRI report doesn't really give me a time and place of when that occurred. It
Right.
just tells me that you have this,
Yeah.
right?
Yeah.
Nor does it tell me how did this get
Yeah.
there,
Yeah.
right? So I want to, for this particular patient, I want to see you run. Let's get you on a treadmill or give me a video recording because I'm not going to wait for you to run 2 miles.
Right.
Right? Let's see you run on a treadmill for 2 miles and let's see what's happening in that system. Oh, have you ever had an ankle injury, knee injury, back injury, neck injury, anything circa that time when your low back started hurting? Oh, yeah. Actually like 6 months prior, I did have an ankle injury.
Right.
Oh, really? Oh, what happened?
Yeah.
It's just painting those pieces together.
Yeah.
Oh, that ankle you got injured. There's 33 joints here.
Right.
26 muscles, over 100 muscles and ligaments that
Right.
attach right to the ankle.
Right.
Have you ever rehabbed that ankle? No. I just rested it. Pain went away.
Right. Everybody he's seeing is focusing on the right lower back. They're not like thumbing through the history to get to the etiology.
Because it doesn't make sense, right?
Yeah, yeah.
You're a runner. Oh, Dave, I've been running. I'm an athlete all my life.
right.
And then let's say 3 years ago, mile number 2, 3, like my back's just been killing me.
Yeah.
Oh, it's because you sit long hours.
Right.
Oh, you're getting older.
Right.
Right? Yeah, let's say you're 43. Oh, yeah, but you also age the same way on the left side, right? It doesn't fit, right?
Yeah.
Is that a rationale that sits with you?
Yeah.
And I think that's where a lot of patients start looking for other alternatives. Like,
Right.
yeah, it just doesn't, it's not working. Oh, maybe I'm just kind of broken now.
Right,
Oh,
right.
maybe it's this. And they start theorizing and
Right.
making their own conclusions.
Right.
And then what happens is I don't run anymore now.
Right.
It used to be a time where I can just clear my head. It was my own stress relief,
Right.
blah, blah. Now I don't do it. Now I have to find alternate means, right? So oftentimes I find painting that picture for them, connecting those or helping them connect the dots, I think that's where the healing journey actually begins, right?
Wow, that's
So,
incredible.
Yeah.
That's really interesting. I feel you just fixed my back just by talking. Jesus Christ, right? Aren't you floating?
We
a little bit?
were talking like I had a knee injury like a couple years ago. We were talking about it. He's like, it might have been your ankle that you never fixed.
Yeah.
That you never did physical therapy.
Can I say one thing?
Yeah,
We
go
have
ahead.
questions, I assume.
Yeah, a lot of
All
questions.
right, I just wanted to say one thing because that was awesome. You talked about the history, the importance of a history. So I don't know if I've said this like on this thing, but I don't know, Mo. You tell me. But I brought this up a few times in my life since it happened. Like for the people not in like healthcare, guys like Dave and me, we the classic paradigm is like a history and a physical, right? You talk to a patient to understand why they're there and what brought them there, and then you examine them and then you take those data points like what they told you and what you're seeing, and then you put it together. That's your history and physical, okay? So when I was an intern in residency, when I was in my first year, the first month of my rotation, they put you with a senior resident, right? Like you're young, they put you with like a senior guy, right? So I was, and it was the first month was in the pediatric emergency room at Newark,
Yeah.
So I remember they put me with the senior resident, and I was like, this guy's like, running around like a senior resident. I don't know anything. I mean, I'm like so nervous that I'm going to screw 100 things up. Gunshot, teen pregnancy, like we're in the peds ER in Newark, like just crazy stuff. And I remember we would start the shift in the peds ER, and he was the senior resident doing the admissions. And even though the peds ER was on the ground floor, we spent the whole night upstairs in the call room. And so when you don't know, you don't know.
Mm-hmm.
You think that's normal.
Yeah.
And this guy would sit up there, and the peds ER, you had like a beeper back then. They'd call and they'd be like, "Hey, Dr. So-and-so, we have this, kid. She's 6 years old. She, has head trauma and blah, 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 blah." And he wouldn't go down to the ER. I'd be sitting next to him, and he'd be like, "Did you do this? Did you get an MRI? Did you do this? Did you do that? All right, call me back when you do." And you hang up. Then like an hour later, the nurse or the person downstairs would be like, "Hey, we got these imaging. Did you get the blood work? Did you get the urine? No, call me back when you do." Then like the shift's almost over, and they're like, "Hey, we got everything you said. Do you want to come see this?" And he'd be like, he'd go into the computer and he'd look at the labs, look at the imaging, and without seeing anything, be like, "Okay, I guess you could admit her to this, that, and that." And then they'd admit the kid, and he'd start writing the admission note. And in my mind at that time, I'm like, this guy is such a good doctor. Like, Can you imagine, like without even seeing the patient, he could like this, that, and the other. And then it wasn't until like a year late, because then, after you do a month of PDR, you do like ICU, you do like cardiology. Next year I'm doing it and I'm a resident and I'm there. And now I know a little more. And I'm with this other senior resident who's excellent. Her name, I will say, because it's a compliment. Her name is Manpreet. She went on to do pediatric oncology. She's one of the smartest doctors I ever worked with. And so I'd be downstairs with her. And I was expecting to be in the call room again. And when someone was in the peds ER and they might have been admitted, she would go back into the room in the ER and she would repeat the whole history. And then the ER resident would come and be like, hey, I just told you about the kid. Why are you going in there? And she's like, I just need to hear it from the family. And she would take like a 45-minute history, even though the resident from the ER already told her, hey, it's a 6-year-old with head trauma, blah, blah, blah. She'd be like, okay, thank you. She'd go, sit with the family, talk to them. And I realized like how different the same history or physical, the same approach, how like worlds apart, right? And that's when it struck me that other guy was an ass, right? Like being lazy and just didn't want to take shortcuts. And here, this doctor was teaching me that the history was everything. Talking to the patient was everything. And then what she really taught me and is history is like 80% of it.
Yeah.
Like patients come in all the time, and this is advice for people listening. Get me a blood test and get me imaging. I always tell people, if your doctor is ordering a bunch of tests, it's not because they're good and they know what's going on. It's because they're desperate and they don't. It doesn't mean, and that's point blank true. That's not hyperbole, okay? If you think, hey, that doctor's great, he sent me, I hear this, no, he sent me for every test. I'm like, listen, I order tests sometimes, right? And it's very specific, but shotgun medicine, ordering a bunch of tests, a lot of times patients, I think that when the doctor sits and talks and doesn't do, they're skimping on being a doctor. Those are the best doctors. So I just wanted to call that out because when you were talking about the history and that's such a lost art in medicine.
Yeah, and it's heartbreaking, right? I hear it even in my own field. Like I go to these continuing education courses, as we all need them, right? And it's sad because I think it'd be nice had you had never met that other doctor, right, in your second rotation, like your whole framework would have been if those were the only doctors you met, like your first experience, right? Yeah. You know what I mean? That would may have been a different trajectory, right? And just be like, wow, right? And so I really do, stress finding good mentors, finding good.
Yeah, it happened to you with the
I was
Institute
very
of
lucky.
Physical Art.
Yeah, I was very fortunate, and you're right. 80% of it was like, does the history and the objective, does it make sense, right? Does this picture make sense to you? And if it doesn't, we got to start asking more questions and asking the right questions, right? And so. I agree. Yeah.
Awesome.
100%.
Should we do some questions?
Yeah, we got a lot of questions. We'll start with this one because it's kind of on the peds topic. Someone asked, I've been struggling with back pain ever since giving birth. Do you have any tips?
That's a great question. I've been struggling with low back pain ever since giving birth. Right. So the thing is, and I was just talking to Mo about this, right?
You had a kid?
No, we were talking.
A lot of times, right?
You would have seen him.
Yeah, right.
And this is actually one of the reasons why I reach out to you, right? Because I have so many moms, right, like who come in after the fact that they have a child, right? And I'm like, only if I saw you when you were, when you just conceived or after your first trimester, right? Because a lot of times when, once a mom delivers and has the kid, the primary focus is now the child. Right. And for me to teach the mom to be like, all right, let's try to modify this now when you're already struggling with a lot of pain.
Right.
We can find some value in it, but I'm very curious about to that patient. It's like, I'm really curious of how, like some of the experiences you may have had before, some of the habit patterns, some of the inefficiencies in your system before, right? But to answer the question of what can I do right now? Honestly, I would go see a physical therapist who's going to get a really good history. And understand when does it bother you the most, right? Like, is it with sitting? Is it when you're feeding the kid? Is it when picking up the kid? Is it when you're coming off the toilet? I want to know every detailed part of your functional life in a 24/7 hour sitting, right? And once we have that information, we can modify and show you correctives or new ways of either picking up the child or exercising in such a way that can hopefully alleviate some of the pain, right? But you tell a mom who just had a kid, hey, can you do these exercises and spend 20, 30 minutes? They're going to be like, yeah, okay, right? Not going to happen,
Yeah.
right? But if they understand that, hey, look, every time you pick up the child, you're going into this lumbar extension. Every time you're sitting or you're getting up, you're doing this, and it's just jabbing into your lower back, and this is why it's actually aggravating. Once the mom understands that, and they're like, all right, so I have to put my pelvis in this position when I pick up the kid. That's all they're thinking about. So now every time they pick up their child, it's an exercise for them, right? And they're like, oh, wait, after about a week or so, I feel actually a little better, right? So I want to try to create a program for the mom, right, that's actually feasible, and for her to realize, oh, that's what's causing my low back pain.
Right.
Oh, I'm feeding my child like this. Oh, I'm doing this, you know what I mean?
Right.
Let's tailor the program around that.
Yeah.
So I can't just, unfortunately give like, hey, just do these exercises, do 3 sets of
Right.
10 and you're fine. You know what I mean?
Yeah.
So,
Cool. Next question we got. Oh, this is a good one. Someone asked, does the position you sleep in matter? And if so, what's recommended?
that's a great question. That's a very popular question. Yes, the position you sleep in matter, but more importantly, probably, there's 4 options usually, to generalize it, either on your left side, right side, back, or on your stomach. I'm probably against sleeping on your stomach more than anything, because your head's rotated for a period of time, right? But if you are going to be sleeping on your sides, getting the appropriate support, and this is something that we actually spend about 15, 20 minutes with some of our patients who have this question. And if you're suffering with like neck pain or low back pain, I want to see how the pillows are being utilized, right?
Okay.
Each arm in our body weighs what? 5.5%, 6% of our body weight. So if I have neck pain and I'm sleeping on my side and I'm scrunched up and my arm is hanging off to one side and my neck pain is acute, I want to use pillows in the rightful manner to support this limb so it unweighs some pressure in the neck, right? So is there a right way? Whatever you can fall
Are
asleep to.
you
and stay
deliberate
asleep.
about how you sleep?
No,
Like being an
I sleep on
expert-
my back.
But
I
like
sleep
when
on
you
my-
sleep on your back, do you sleep like how? Like, do you not look to the left or right? Like
Oh, no. I sleep. The neck has to be like, the tissues have to be like in what we call like in a mid-range loose packed position where the tissues don't have any tension. in
Yeah.
them, right. And I can't even, like, I would love to just put you on a table like, look, Zay, like, let's kind of put you in this situation. But, look at your body as like a bunch of different lever systems,
Yeah.
right? Like the joints are all stress points, right? And if you're lying on your side, and if I put a flashlight along the side of your body, where are the areas where it's actually like a fulcrum, right? Gravity, we can't escape gravity.
Right.
So it's constantly giving us this compressive load. That's where having the right pillow set up, the right mattress set up, the right support systems for your body is so effective. And that may be one of the reasons why a lot of people toss and turn and they're just like, I don't like this. You know what I mean? You look at a child. I mean, if they're in a comfortable state, they'll stay there.
Yeah,
right?
yeah.
They're not moving,
Yeah.
right? But they're also very efficient in their mechanical system.
Yeah.
Right?
Yeah.
Their tissues and their ribs and their muscles, ligaments can all adapt to that surface and they can just pass out that
Yeah.
way. Right? A lot of us are a little hypomobile here. We have some arthritic changes here. Our
Yeah.
shoulders are a little banged up. So when we're sleeping on a surface or in a position that's contributing to that or like is amplified by some of this, it's uncomfortable, right? So
How about people who say you should sleep with no pillows?
I would love for someone to get to the place of being able to sleep with no pillows.
Okay.
That's telling me, look, if you're sleeping on a hardwood floor, let's say,
Okay.
with no pillows,
Yeah.
right? That means that your system is mobile enough and springy enough to adapt to that surface, right?
Okay.
Without giving too much tension. But if you're rigid in your lower back and you're rigid in your thoracic spine, your rib cage, and your neck is just bobbling back,
Yeah.
right? Now you just created a fulcrum, and there's going to be a decent amount of tension on the joints and the tissues, and you'll wake up and be like, "Why am I a mess?"
Soft
right?
mattress or hard mattress?
That's a hard one, right? These are the questions.
No right answer. It depends.
Mattress Firm hates me. I'll tell patients, don't try not to order your mattresses online if you can, or if you do, go test out the mattresses.
Okay.
Right? Spend about 5-10 minutes there with the pillow that you like, because you may have the greatest mattress and your neck hurts because you have the wrong pillow mattress combination.
Right.
And how do you feel when you get out of that mattress? Not just how you feel when you get in,
Yeah.
right? Because for me, Tempur-Pedic is just not a right fit for me.
Yeah.
Right? The spring is a little too, it doesn't fit for me. A hybrid works perfectly for me. I'll spend 15 minutes at Mattress Firm. I'm a back sleeper. I'll bring my pillow and I'll stay there for about 15 minutes. And then when I get out, I feel good.
Okay.
Right? But let's say I'm in a Tempur-Pedic and I'm in the same position. I'm like, I feel awesome here. And I get out and I'm like, oh, my back hurts.
Okay.
It's not the right mattress for me.
Okay.
Right? So
What kind of sleep are you?
is-
Do you sleep okay?
I'm like all over the place.
I'm a
Toss,
disaster.
turn, toss, turn,
I'm
kick.
everywhere.
Kick, punt. I talk in my sleep.
Yeah. Yeah.
But I like have a million pillows on my bed. So
Dude,
love.
same.
I don't know. Like if you like sleep with like less than 2 pillows,
You're a
like,
freak.
Crazy.
Crazy.
Like at least
You might
at
be
least-
healthier than us,
Yeah.
but there's something wrong.
Yeah, like
Not
at least
physically.
2 pillows. Yeah, and staying on the question of sleep, someone asked for side sleepers, is it suggested to sleep with a pillow in between our legs? I noticed my hips would bother me, and now they don't as much with a pillow.
It's a great question. So I don't know the exact percentage of the lip for the lower extremities. I should, but a lot of times people say, "Oh, I'll put a pillow between my knees." Right. The one thing I'd probably suggest is try to get a larger pillow and really get closer to the groin and have the pillow get all the way to the ankle or the foot. Right. A lot of times I'll tell patients to get 2 pillows because one pillow will just get the knees. But we're also still talking about the empty space, right? If I just put a pillow right between, let's say this is my pillow, right? There's extra space. Like there's an actual space between my femur and my shin bones, right? That's not supported. The tissues understand that, right? And when you're on your side, that's empty, like avoided space. So filling that space up with pillows will actually unweigh the entire leg, and that'll reduce the tension on your pelvis and your lumbar spine. So if that's providing help, sure, but what would probably provide more relief to the hips would be just adding another pillow and get it closer to the groin.
Nice.
Right.
I have a full body pillow. It's like the best thing ever.
Right.
It's like
I've never even heard of that.
It's the size of me. It's the best thing ever. You should get one.
Do you hug it? What do you do? with it?
Like you just like kind of.
But you're single.
Yeah, but like
See,
I feel like when you're with your wife or your girl, whatever.
So you'd have
It's
like a
just
full
too-
body
it gets-
pillow and your partner?
No. The partner.
One's gonna get
'cause
jealous.
The partner will because the full body pillow is not giving off heat.
Right.
You sleep comfortably.
And doesn't talk back.
Exactly.
There you go.
Got it.
And you
Doesn't
can punch
snore.
Yeah.
You know?
Exactly.
On to the next question. Sharon's like, I need a snuggle buddy. Question is, here we go. Someone asked, can physical therapy provide relief for chronic migraines? And if so, how?
Oh, that's a great question. Depends, right? I think clinically I've found it goes back to history, right? When someone's been struggling with chronic migraines, right? Now we're talking about like a systems approach of looking at, I want to look at everything from posture ergonomics. What's the behavior of these migraines, right? If it's a female, is it related with their ovulation cycle? Is it during menstruation? You name it, right? Is it someone are these migraines coming out first thing in the morning? Are they coming midday when I've been working in front of a desk all day? Is it something I get towards the end of the night? Is it when I'm actually eating certain things, right? Like we're getting into like the nitty gritty details, but for someone who's been dealing with this for so many years, I think patient education first has to start. These are some of the clear-cut triggers of migraines. Now, from a physical therapy standpoint, a lot of times, like my desk workers, those who are sitting, right? I call them your professional sitters, right? You're professional sitters, right? That's your sport,
Yeah. Right.
right? And so your seat, your computer monitor, your desk setup, that's the equipment to execute to the best of your ability in that sport, right? And, like my wife would be totally cool with me sharing this. Like she suffered with that, migraines, like, and even some vertigo, right? And this actually was it manifested a lot during COVID when she started working from home a lot, right? And she's in corporate and she's there all day. And she never had these kind of episodes when she was at work, And the desk setup was very different. So the history is very important. When did this begin?
That's
When did you
interesting.
start getting vertigo? When did these migraine, what does that look like? Is it behind the eye? Is it like a halo? Because depending on where that migraine is, it may be a referral pattern at a specific level of the cervical spine of the joint.
Sure.
Right? So I'd want to know a lot more details. So yeah, short answer, yes. I think we've had some good relief, but really kind of understanding what the triggers are. And is it even the setup of your workstation, right? Ergonomics.
So it might be a different chair.
Chair, height.
Height, right.
If
Height.
someone comes in with low back, neck pain, and they're like, Dave, I get this like every day. Is it worse in the morning? Do you get it first thing in the morning? No, actually, the morning is the best time I feel. So then we know that sleep's not an issue.
Right.
We know that your pillow position is probably legit.
Right.
Your mattress is legit. So let's rule that out.
Right.
Actually, as the day progresses, I get this throbbing headache. All right, cool. What do you do for a living? I'm an attorney, blah, 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 high stress environment. All right, cool. Can I see your desk setup? Right? Take a picture of it. I want like all my patients who work in this setting, like that's their homework.
Right.
Right? Like I can give you all these exercises. Great. Give me a picture of your desk setup. Get an angle from all. Ask your coworker to do it.
Yeah.
And just don't. You know what I mean? Like have someone just take a picture without you even knowing.
Yeah. Right.
And that'll give me so much more information.
Right.
Right? And then I'm like, all right, let's go there and now let's modify things.
Right.
This is why this is relevant. Because when your posture, your ergonomics are all screwed up, the first thing that gets compromised is respiration, breath. Okay. Right? And so when respiration is screwed up, you're not breathing right, you're in this like upregulated state, you're in a stressful environment, boom. Those are just kind of recipe for possible catalyst for a migraine, right? So,
Awesome. Next question is from one of our moms. She said, can you emphasize to my kid as he's listening with me how important posture is?
Yeah, posture. Posture is very, very important. Posture is so important. Like I get this a lot from moms. They'll send their kids and they'll be like, "Can you please talk to my child?" And really, it's like, "Can you tell them to get off the phone?"
Yeah.
Right? Yeah. Can you get off the phone, get off the laptop or the iPad, right? Posture's. You know what it is? It's when you're in an inefficient posture. Like I said, to add to what I was saying, respiration actually is compromised. Right?
Can you go a little deeper on that? Because you said it twice.
Yeah.
And I think it's unclear what the connection is. Can you just go deep on that?
Yeah. So the primary, you probably know this better than I do, right? Like babies, right? No one really teaches a baby to go through a certain developmental sequence. Right? At roughly 7-8 months, they sit for the first time. Did you ever, in a baby that has gone through efficient, milestones and stuff like that, have you ever taught a child how to sit properly?
No.
Probably not.
No.
Right?
Yeah.
They sit right on their pelvic floor. Their belly's not tucked in. They're not sucking in their belly.
No.
Ever.
No.
They're not tightening their core.
No.
Right? And their rib cage and their pelvic floor is stacked right on top of each other to do what? To breathe and stabilize that sitting posture so that they can interact with the world. Right? Before stability is going to be your ability to respirate, right? To breathe,
Sure.
right? And that's the primary function of the diaphragm.
Sure.
But what a lot of people forget is that the diaphragm is also one of the most, if not the most core muscle that we have, right? But when posture is inefficient, if I'm in this slouch position like I am now, right, that rib cage is going to compress, right? It's going to close off my diaphragm where I don't have access now to my primary respiratory muscle.
Right.
So my primary respiration muscle is compromised. My primary stability muscle is compromised. So what does my body need to breathe?
Yeah.
What am I going to use? My secondary, right, backup supply to breathe, right?
Right.
Scalenes, upper trap pec, right? And so that's now what I'm using to actually breathe. And your brain's smart, right? Because the brain's like, why is he now having an elevated heart rate? Why is the respiratory going up? Why is his CO2, O2 levels being weird? Is he in threat?
Right.
Oh, there's an increased level of stress. Now we're in this low-grade fight or flight state.
Right.
Right? So I'm more concerned about the long-term consequences of a dysregulated nervous system with posture than just the musculoskeletal issue, right? So if you're a child, you can get in and out of posture is great, but you extrapolate that over the course of 20, 30 years, like I'm 40 and let's say you've had crappy posture for like decades. Now we're looking at a systemic effect. Oh, I have chronic neck pain. I have chronic migraines. I have anxiety. I have this. Oh, my diaphragm doesn't work. I don't even know how to breathe properly. Right?
Can we just dissect what so I'm both ashamed and inspired at the moment. I'm ashamed because I get asked about posture. How many times people come to us
All
and
the
like
time.
they're there for the physical. He's like 16, whatever. And I'm like, all right, you're cool, blah, blah, blah. How's
Mom's like
school?
convinced he has
And-
scoliosis.
yeah. And the mom's like, Dr. Baker, Mo, can you talk to Jimmy about his posture? Meanwhile, when she's asking me, I'm sitting there like this, and then I always like sit up, and I'm like, yeah, I'll talk to him about his posture. I'm like, you should sit better. Like, I don't know what do you want me to tell the kid? So I've been asked this question a million times. I never knew anything you just said at all. Like the correlation or the relationship between the neuromuscular and then the secondary effects, and then how it can, invoke, this. What did you call it? The low state of fight or flight.
Right. Like that's where most of us live in, right? Like
And then the cortisol levels.
Totally.
Then it causes anxiety because you're in a
Totally.
perpetual state of. That's crazy now.
because right, I mean, you see it too, like babies, right? You want to know that they don't.
Yeah,
They're breathing. Their belly's
Yeah.
like nice. They're relaxed. There's
Yeah.
not that much
Yeah,
tension.
yeah,
They're
yeah.
rolling around, right?
Yeah.
That's what I think. We got to get back to.
Yeah.
Right.
Yeah.
And like, no one teaches a child to sit up straight.
Yeah.
It's when they're introduced to external environments. It's like, oh wow, another this phone.
Right.
Now,
Right.
emotions driving that, and they're doing this.
Yeah. Yeah.
Right. And
Yeah.
that's appealing, right? So, that's what I've been seeing a lot, and so
That's incredible.
it's kind of important.
Yep.
And also like with GERD too, right?
Yeah.
Like a lot of
Reflux,
people
yeah.
have that reflux. There's a high correlation
Yeah.
with posture and like let's say stomach issues. Your diaphragm's now turned off. In the efficient state, when the diaphragm you breathe, that diaphragm should push the contents and give your belly like a nice massage.
Yeah. Right.
But now you don't have that ability to do that,
Right.
right? So visceral functions are definitely can be compromised as well. So
That's great.
Interesting. Next question we had, this is about pelvic floor in childbirth. The question is, I've heard about the importance of preparing pelvic floor for childbirth. Can you explain more about this?
yeah, that's a great question. There's an entire specialty in physical therapy that really focuses on pelvic floor physical therapy, right? And I think it's very, very important to work with someone, especially when you're preparing, and especially someone who's gonna, and they all do, right? Look at the pelvis, look at the whole system from the head down, and really understand, hey, does this pelvis have the ability to go into this nice neutral state? We make this assumption that, hey, my pelvis is neutral, or it has the ability to get there, right? And quite honestly, when expecting moms, when their hormones are changing, their ligaments are preparing for childbirth, so they are a little more mobile. So it is a good time to actually work with the pelvic floor specialist to, for the education, number one, and really get a full assessment of like, hey, how's the pelvis, like the foundation and the infrastructure around it, how well is that moving, and is it stabilizing and doing its natural intended functions, right? And hopefully that'll trickle down into a nice, hopefully natural delivery, right? So yeah, I think that's very, very important to consult with a pelvic floor physical therapist.
And then that's it for the physical therapy questions. I don't have any more. Let me see if you have. Our yoga instructor, she wanted to know, what are your thoughts on yoga with like your physical therapy space? Like, is it beneficial to your patients? Do you ever recommend
Do you
it?
ever recommend yoga?
I don't care what they do. I want just find the right yoga instructor.
Right.
It comes down to the practitioner, right? Like I spend like probably weekly, bi-weekly. I want all my patients to move, right? Find an activity, find an exercise, find something that you love to do. I don't care if it's salsa, like whatever, like salsa, like hip, whatever it is.
Basketball.
Whatever it is, yoga, Pilates, right? All that I ask is, hey, why don't you get an evaluation to see what are the movements in these, exercises that you should do, and possibly avoid at this point right now. Maybe you can modify certain things. And I would love to connect with your yoga instructor, and if he or she would be willing to connect so that we can collab on this, right? And so that's what I'm doing a lot of times. There is no, oh, don't do yoga, don't do Pilates. No, like
Just moving.
Movement's important, but like yoga, right? Like I think that's a good question, right? But find a practitioner who really can meet you where you're at.
Yeah.
Right? Like if you're hypermobile, right? And a lot of times people think it's like, oh, yoga's great because I'm so stiff, right? What people have to realize, you're probably very stiff because your body finds instability in your system. So the ligaments and the muscles actually stiffen you up. It tightens your system up. So then rather than yanking on tissues that are tight, maybe we have to find areas that you're unstable, right? So if you work with a good yogi or yoga practitioner, they'll be able to help identify those areas and give you a stability program so that then you can do these very elaborate flexibility exercises, right? So I'm a very big fan of yoga. I don't practice it, but I've seen some great benefits with yoga.
What's your fitness like go-to stuff? Are you like a traditionalist, like jogging, lifting weights, push-ups? Like, what do you do? You're a racquetball guy?
Yeah, like running is more of like a headspace type thing.
Okay.
You know,
How often do you run?
You know, probably about 3 times a week. I wouldn't call myself a runner, but like I'll go like run a 5K, you know, like a couple miles in the morning just to kind of clear my head.
You run a couple of miles in the morning. You don't think you're a runner?
I mean, like, you know, I'm
In
not
my
like
book, that makes you a world class. Like, come on, like you didn't sound like having a cup of coffee.
right? No, like you know what I'm talking about.
I don't. That's a problem.
Fine. Right? But I'm not like good at it. Like my pacing is not. I'm not like doing.
But you're
like sub
consistent.
6. It's more of like I'm not so worried about the pacing.
Okay.
Or like I'm worried about the pacing. But I'm not worried about like time or whatever. I'm just like I need to just run for
Do you
about
listen
30
to
minutes.
music or anything?
No, I used to.
You don't have earbuds in when you're doing it?
No, I used to
You
actually.
just raw dog, like you just running with no music,
And
no
I sound like
podcast.
too much like a nerd if I say this, but like, you know, I have inefficiencies in my own system, right?
Okay.
I've had a lot of injuries, my foot and everything. And what's funny is when you're running,
Okay.
I want to hear how my left and right foot actually hit the ground. I want to see I want to feel what my shoulder blades
Really?
are doing. Yeah. So because I'm inefficient in my system, I know if I'm listening to earbuds or whatever, everything is going to go to shit, right? I'm going to
Wow.
run whatever. So a lot of times when you see an inefficient person run, you know, we'll do that in the clinic. We'll be like, hey, Dave, I have pain in my right ankle when I run. I'm like, all right, go run. It's like, wow, you are hitting so hard on the ground every time that right leg goes down. Then it's a question of why, right? So like even the sound of someone's gait or their running is different when the right and left foot hit the ground, right? And then the question is why, right?
Wow.
So I know I recently started doing that and just
unbelievable.
kind of understanding, because your shoulder girdle and your pelvis should be moving kind of like as reciprocal movements and
Okay.
it's unison.
Okay.
When I'm running with the AirPods on, everything goes to shit, honestly. So I'm like, I want that to be a little more efficient, right? As I get older, I want to be a little more efficient, right?
That's
so
crazy. Like,
that's
do you
what
know
I'm-
this? Have you heard of David Goggins?
Yeah.
Because once I've like, obviously, you know, like most guys, like I've come across him several times, right? And like whenever I do, I can't stop listening to him. It's
Yeah,
one
of course.
Where he's like, "You're nothing." He's like, be hard, get stronger.
Yeah,
and you've
yeah,
heard
yeah.
this guy, right? He's
Totally.
like a beast.
Stay
Like,
hard.
Yeah,
Stay hard.
I could have worked 12 hours. But it could have been the busiest day of my life. Exhausted. And if like I'm very weird. I'll listen to like podcasts overnight. My wife loves it.
Uh-huh.
I'll like put like I'll like put the podcast on and I'll just like listen. And there's things that are like 3 hours of David Goggins, like
Yep, yep,
those
yep.
kinds of things. And like if it comes up in the algorithm and I hit it, like half the time I don't know what I'm hitting, but it'll be like 3 a.m. I'm half asleep, half awake, and I hear him.
You're getting up.
I'm like, I'm
go.
gonna go outside. I'm gonna do 100 push-ups, and then I get up, go to the bathroom, go back to sleep. But like he's incredible. And one of the things he said that blew my mind when I first heard it, he runs like 30 miles. He runs
200,
right. And he's like, I forget who asked him. They're like, "What do you listen to when you run?" And I'll never. And he's like, "What do you mean? I don't listen to anything." They're like, "But you just said you ran like for 12 hours." He's like, "Yeah." They're like, "Why don't you listen to anything?" He's like, "Because that'll soften it. He's like, I want to be in the pain. I want to be in the door. I'm like, this guy is a different species.
Yeah, totally.
I'm like, if I go to the gym for 5 minutes, I have like Metallica on the loudest to like numb the experience and distract me. And like, I hear this guy, I'm like, this guy's a different species. But you're the only person I know that like, we had a student, what's her name?
Sam.
But I was talking to her and she's like, oh, sometimes, but like, you want to hear your body. So you're listening to your body as you're running, basically. It's telling you're in, like it's like a pretty
I can only
spiritual
focus
thing.
on a couple things, right? Like I can only focus, even when I'm at the gym, like, and this is a recent thing, Z. This is not something I've been practicing for many years, right? This is probably over the past like year, right? That I'm like, all right, like when I'm at the gym, like, you know.
Do you run outside or in the gym?
I run outside.
Okay, but then you also go to the gym. Yeah.
I also go to the gym, right? And I used to put on the earbuds and I'd be like, all right, you know, and I'd be like you, I'd like, all right, I need goggins on, right? I need something on to motivate me, right? And I'll do the movements, right? And I'll try to be like, but I can't focus on them. I'm not feeling it as well, right? Because I'm kind of pumped up with the adrenaline and stuff like that. But really getting that out of the picture, I can really hone in on the actual exercise, right? And to a certain degree, I do agree with Goggins. It really pushes that barrier, right? To really like, wow, that really is my limitation.
So now your practice is in Fort Lee, right?
Correct. Yeah.
You live in Fort Lee too?
Cliffside Park.
Okay, yeah. Okay, great. Yeah. Yeah, I grew up in the area, so
Nice.
I know there. So, and you have a couple of guys that work with you?
Yeah, I have Dominica and Sang, like a guy and a girl. Yeah.
That's great. And we're going to put all the
Everything.
information because this is incredible.
Yeah, it was amazing. Are you a basketball guy?
Me?
Do you watch basketball?
A little bit, yeah, but I don't play.
You don't play. Have you been watching the playoffs?
A little bit, on and off.
On and off.
Yeah.
We're obsessed.
Obsessed. Yeah, like it's like the only like we come home.
Pathologic.
Yeah.
Like Diana hates it. She's
What
like,
do you think of like from last week to this week?
It's crazy.
Dallas going up 3-0.
Who do you think, Dallas or Boston?
I looked at it from the Pacers' point of view. Nembhard and TJ McConnell were cooking the Celtics. So I can only imagine what Luka and Kyrie are going to do.
Porzingis is going to come back.
Porzingis is going to come back. He definitely won't win without him.
Yeah.
I think I don't know. You can't count
Dallas from way back.
You can't. He did on the live
Yeah.
when he did it with Siraj. You can't call Dallas. You can't put them out because they just basically ran through the Timberwolves, who just beat the defending champs.
It's crazy.
Crazy.
Yeah.
You got a big game 5 tonight.
Yeah, I'm going to watch that.
What do you think of Anthony Edwards?
Love him, but definitely people fell in love too quick.
Too quick.
Yeah.
He's also still on his rookie contract, so got to cut him a little bit of slack.
He's awesome, but
Yeah.
like, how dare you throw around MJ?
Yeah.
Where do people get off doing that?
Yeah.
You know, so.
That's all I got for tonight.
Man, I can't thank you enough.
Oh,
this
no,
was
thank
awesome.
You. Thank you so
This
much
was
for having
beautiful.
me. This was awesome.
You're like super gifted, man. This is great.
No, not at all.
Your clients
Not
are
at
lucky
all.
to have you, man. Thanks for doing this.
Thank you so much.
Yeah, for sure. Yeah.
Awesome.